price data in their work at all?
I was hired as a consultant for Sight and Life to develop an affordable, nutritious product for women of reproductive age in Ghana. So we wanted to find the most affordable product we could use to develop this nutritious product for women. So I remember I used to go to Isoko. Isoko is a platform in Ghana and they have all these prices. I used to go to compare the prices of commodities to give me a sense of how much things are sold on the local market, produce are sold on the local market to help us develop the nutritious product.
So I once led a project to introduce fortified rice in Brazil through commercial channels. And we looked a lot at the price of just non-fortified rice to see in terms of, what the optimal or, what the market would bear in terms of the higher cost fortified rice. So we did a bit of pricing analysis there.
I use software which is called Propan, which is mainly developed to see the IYCF, the infant and young child feeding practice. And with that one, we also try to look at the calorie intake and also the price per calorie. How much price you will cost for calorie.
I'm an economist, so we use price data quite frequently. A couple of examples, most of my career I've worked on water management issues, so one of those, we were looking at the profitability and the environmental sustainability of dams around West Africa, because I was based in Ghana here for 7 years. So we use food price data to understand and look at the long-term profitability of operating the dam and using that water for certain type of farming vis-a-vis other types. And also we did in Ghana some studies on rice profitability and the impact of the duty policies on imported rice and whether that has any impact on the local production of rice or whether it's more of a quality differential rather than a price effect. So those are just two examples of my work.
Great. So there's lots of food price data available and lots of different uses of it, and we're going to go through ways that you can use food price data to understand nutrition, the way we think that governments can be using the data they collect for nutrition-sensitive agriculture. So the overall motivation for this work is the vision that food price measurement should reflect the food that people need for active and healthy lives. Because as the UN published and has been agreed by countries for more than 20 years, food security is when all people at all times have physical and economic access to sufficient, safe, nutritious food to meet dietary needs and food preferences for an active and healthy life. So I think that this attention to the full meaning of food security is something that this community here, focused on agriculture and nutrition health linkages, has been helping to reframe in the global discourse about food and nutrition, because for a long time it was really considered, and it is still in many parts of, in many conversations, considered to be something more like sufficient rice or rice prices, which are indicating food security. And we want to broaden that definition, or broaden the measurement and the discussion to really reflect what is really meant by food security. And it's also, food prices are a way to measure food access. And it's also beyond just food security, looking at the availability and prices of what's out there, because food environments are changing very rapidly in some situations. And we really want to understand if nutritious diets are becoming easier to buy or further out of reach. So if we're tracking food prices over time, what is it that we're really looking at? And are we measuring what we want to know, which is whether people are able to access nutritious diets? This is a picture taken here at Nsawam Market, and you can see kind of the The food environment here in Ghana has shifted a lot over the recent decades, and here you can see, there's a mixture of unprocessed, fresh commodities and packaged sodas and a lot of different foods available in this changing food environment. And the New York Times really focused on this earlier this year with a feature story on Ghana and the shifting food environment and health implications. And as I'll go through, the way that food prices are typically measured has more to do with what people buy and what's economically important than what is nutritious. And so we want to make sure that we're able to have metrics that aren't just tracking with what's most economically important or what's most purchased, but what's most nutritious. We're going to go through some basics of what really is the cost of food. It sounds very simple, but there are a number of ways that that's already been defined. Overall, in this discussion, we want to clarify why are we interested in food prices. And this is a very general picture of the need for information that we can use to make the linkages between agriculture and nutrition, with food access being this key piece, which agriculture affects. But then how do we look at what is agriculture doing? What is the impact of agricultural policies and programs on food access, and always keeping in mind that what we mean by food access is nutritious food to meet dietary needs. So we really have inadequate information, this chain between agriculture, food access, diets, and then nutritional status. And we felt that the access information with regard to prices that has been used in modeling isn't really capturing what we really want, which is nutritious food. And so I'll go through what these existing metrics are that have been tracked and used to date. So there's no kind of one cost of food. When you hear food prices in the news, this hopefully will shed some light on what it is that's actually being talked about. So first of all, we have three basic kinds of food prices. First of all, we have global food prices, consumer prices, and market information systems. And these are all, the summary statement is that they are all mainly focused on market value and say little about nutritional value. So I'll go through them one by one. Global food price indexes are based on globally traded commodities, and they're weighted by export shares. And these are prices that are actually collected on the ocean, which I've learned so much in this project and collaborating with economists. I'm not an economist by background, and I remember this is an initial conversation with Will when we started, that they're literally collected on boats, these prices, or at ports. And so they're about things that are traded widely. And they might have little relation to local prices, and they are composed of very few commodities. So here, one of the most widely used food price indexes is the one that FAO puts together. And it's composed of 5 pieces: cereals, oils, dairy, meat, and sugar. And there are different individual foods that make up those 5 categories in a total of 23 commodities. But you can see that is clearly not designed to reflect a healthy diet. The World Bank also has a food price index, which sort of similarly is composed of soybeans, sugar, meat, fruit. I'm not sure what fruit that is. It has some fruit at least. Oils and grains. So they sum that into total food, which of course from a nutrition perspective isn't total food at all, but that is what is making up the global food price indexes. And here's just an example of a figure from a World Bank publication which shows how food prices are often presented. So this chart actually combines 2 different types of food prices. There's a world price in there, which is the gray line, and that's what I just described. And then there are country food prices, which are all the other lines, and that's a different kind of data. So those country data are consumer prices, which are collected in pretty much every country by the national statistical organizations. And the main purpose of collecting consumer prices is to monitor inflation. And these data are also used for social programming, like determining eligibility cutoffs for social safety nets and poverty lines and purposes at national level. So they're official statistics that are collected in a way that is there are clear methods stated by UN publications, which every national statistical organization follows to some extent. And they select products for inclusion in the Consumer Price Index, determined by household consumption and expenditure surveys. And so each product that's included is weighted by, if $100 was spent, the weight would be how many dollars out of that 100 were spent on each product. And because in many countries food and non-alcoholic beverages make up a large share of expenditures, they are a big part of the Consumer Price Index. And it's always possible, and many countries report food CPI, which is just the part of the Consumer Price Index that is food and non-alcoholic beverages. So then there's a third kind of food price monitoring, which is a pretty diverse category, which are market information systems. There's a bunch of different actors that collect data that could be classified as a market information system. International agencies are some of them. So World Food Program collects prices on staple food prices, and they publish them very routinely in the Market Monitor. You can find that online, but it's a very small set of commodities, mainly maize, wheat, and rice, I believe. And then there's the FAO Global Information and Early Warning System, which also focuses on staple commodities. And these UN organizations obtain their data from national governments, and in cases where the government data is lacking, they sometimes collect it themselves. And then national governments often have market information systems in addition to the consumer prices, which are collected by the statistical organizations. Ministries of Agriculture or Ministries of Trade often have their own food price monitoring system in parallel, which focuses on commodities that are important for agriculture or trade. And then there are also regional or subnational associations or private entities. So ISOCO was mentioned. It's a private entity that operates in several countries in Africa that is monitoring a list of food prices determined by what clients want prices on, and providing it quickly. That's one of the problems with government data, is it's often not accessible very quickly. And so there are private organizations that will collect and disseminate information in real time almost, so that people have that information right away. And there are other ones, we've interacted in this project with the East Africa Grain Council, which of course collects prices on grain, and that's a regional group. And the Tanzania Horticultural Association collects prices on horticultural products. So there are various actors who collect food prices. So a comparison between the market information and price monitoring and the national accounts and poverty monitoring, the first one, here in Ghana, it's collected by the Ministry of Food and Agriculture. So in general, the actors are agricultural and food agencies, whereas the poverty monitoring is collected by the Ghana Statistical Service here. And so the purpose for the Ministry of Food and Agriculture data, the purpose is informing farmers, traders, distributors whereas the statistical data is for measuring income, inflation, and poverty. The agriculture data, the methods can be variable between, different ministries do the price data collection different ways. They have different products they choose. They may carry scales in some countries, they may not carry scales. There's sort of a lot of issues of how data is collected, whereas for the statistical organizations, the methodology is quite standardized. And the agricultural side is really, it's on focusing on traded commodities, often a few key staple foods and cash crops, but sometimes it's more diverse. And importantly, it really doesn't capture packaged foods because they're focused on agricultural commodities, whereas the statistical side, they're focusing on retail products. They have, a list of standardized items that comes from their national expenditure surveys, the things that people buy, and they're often, they're sold often in urban markets. Sometimes supermarkets tend to have more of an urban bias sometimes than the agricultural side. And the ag side can be representative of whatever level they're covering. If they're covering one market, it's representative of that market, or of a district or region, or here in Ghana, they collect it in many markets around the country, so they have nationally representative data from the Ministry of Food and Ag. And for the statistical side, it is, the purpose is to be nationally representative. Sometimes countries have data that's regionally representative, but not always. So the access can be an issue as well. Here we've been able to get quite easy access to the Ministry of Food and Ag data just based on a request. It's not always published online just because of capacity issues, but it's public data. In other countries, it's not necessarily publicly available. And then there's private sources like Isoko, which exist by charging for subscriptions. And then the statistical side report their data annually, quarterly, often monthly, and again, sometimes the prices, the raw prices, are confidential depending on the country. So a summary of the current status of food price monitoring is we have these three types. Global food prices are very few foods, major traded commodities. Food consumer price indexes are a basket of foods based on economic importance and what people purchase. And market information systems focus often on starchy staples, particularly when they're compared internationally, but they can be very variable. So out of these ways that food prices are monitored, none of them reflects the price of foods that people need to have adequate nutrition or to thrive. It's not the focus of what the data has been collected and used for. But we can use these data in a different way to understand that. So that's really been the focus of first the IANDA project, which was funded by an Imana grant from 2015 to last year. It's the acronym stands for Indicators of Affordability of Nutritious Diets in Africa. And we are working here in Ghana and in Tanzania. So our goal was to use these existing systems, which I described, to develop metrics around the cost of nutritious diets. And the collaboration was between Tufts and University of Ghana, Sokoine University, and Johns Hopkins. And we really designed the metrics around implementation. I think that's a key strength of the project, and the way that you'll hear later on that it's been taken up in Ghana is that from the start, the purpose was to actually use the data. So to do research that would not require additional resources from governments, and that governments would be actually interested in. So we held workshops in each year in both Ghana and Tanzania with the people who collect the food prices from the Ministry of Food and Ag, from the Statistical Service, to understand first how they collect their data, their methods, how to understand the data, how to access the data, and then presented these ideas about how to analyze the data in a way that would reflect nutrition and how these kind of metrics would be of interest or could be used. And we're actually, because we're here in Accra this week, taking the opportunity to continue those conversations this week with the government people here on how to implement these metrics. So now we have been fortunate to obtain an additional grant from the Bill and Melinda Gates Foundation and UK Aid for a follow-on project that continues the work started with IANDA. Now this project we've renamed Kandasa because we're including now South Asia as well. So the project is called Changing Access to Nutritious Diets in Africa and South Asia. And here we've expanded the focus countries to some additional African countries, including Ethiopia, Malawi, and so far Bangladesh and India, but it's flexible based on the data that's available from countries and kind of cooperation with the country level actors. And the purpose here is to take the metrics that we've developed and use them for research into the determinants and consequences of changes in the cost of nutritious diets. So going back to this framework, to be able to say, okay, if we have some variables representing agriculture or market integration or crop diversity, so on the agriculture side, how does that relate to the cost of nutritious diets locally? And then if we can get diet data, which is another big challenge, but whatever diet data is there, how does the price of foods locally relate to what people are actually eating, and then nutritional status? So to really be able to fill in this chain of understanding how the agricultural system is related to food prices, diets, and nutrition. So that's the aim of Kandasa. And I should also mention that in addition, in the learning lab that we did on this topic last year, there were a couple people from the World Bank who decided that the metrics would be really useful for some of the World Bank's analysis as well. So they've funded some additional analysis for South Asian countries on calculating the indicators and using them in a report on nutrition in South Asia to, again, understand these linkages. When we say the cost of a nutritious diet, there are a lot of different ways that we can talk about what a nutritious diet is, and that's probably the biggest challenge.
So from the very beginning of thinking about food prices, people thought, well, what do people need? And strangely enough, the first reference that I was able to find was from the early 18th century here, where we don't even know quite what these units of measure are. What is a quarter of wheat? What's a hogshead of beer? What we do know is that this was done to measure the cost of subsistence for an Oxford University undergraduate. That was their concern, was how much should the stipends be to maintain, and it's clear that their level of inebriation was quite high, even in those days among college students. This was a big concern from the beginning of the discovery of nutrients in the early 20th century, and specifically the isolation of specific micronutrients in the 1930s, such that right away during World War II, for the formulation of rations for soldiers and also for feed for animals in the war, wanting to get to the very lowest cost to meet the initial estimates of nutrient requirements, this was brought into economics by a subsequent Nobel Prize-winning economist George Stigler during World War II in order to compute the first least cost diets that would meet nutrient requirements with the combination of typically a cereal grain plus a leguminous grain plus maybe one other ingredient to get the levels of iron and zinc and vitamins that were isolated at the very beginning of modern nutrition. This was used for policy right away when the US began what is now our food stamp or SNAP program to provide guidance to low-income households in the United States about what combinations of food would meet their nutrient requirements, and then has been used very actively, as you know from yesterday's learning lab about modeling diets, in Cost of the Diet and OptiFood. in very low income settings for the purposes that you saw there. So what we're doing here is building on that whole legacy of previous work to do something quite new, which is monitoring this cost as it changes across time. You'll see from month to month, from year to year, and differs between countries.
3 new concepts that we've introduced with EANDA. I mean, we continue this work on the cost of nutrient adequacy, which, as Will described, has been in practice, but we are suggesting ways to do it which are more easily integrated into monitoring systems. And then we've also designed a price index which can be looked at in comparison to the food consumer price index. So, like I said, the food consumer price index weights foods by expenditure share. So the foods people spend a lot on get a very high weight. And the Nutritious food price index weights foods by nutritional value. So it's not tied to people's spending habits, but rather tied to what's most nutritious. Then the second concept we've introduced is the cost of diet diversity index, which we're not going to go into depth on today, but the idea was to have an index that tracks the cost of meeting at least 5 out of 10 food groups, which are defined in the minimum diet diversity for women indicator. And then the third concept, which we developed, is the cost of recommended diets, which can reflect any sort of set of dietary recommendations, but we've centered it on food-based dietary guidelines produced by countries. So the first approach is the Nutritious Food Price Index. And so this approach, which weights foods in terms of nutritional value, the way we've done that is we use the exact same list of foods, which is collected by the statistical organizations for monitoring inflation. And because people buy a lot of different diverse foods, they often include a long list of foods. In the countries we've worked in so far, it's usually between 60 and even Sri Lanka had up to 200 items, I think. So it can be a very diverse list of foods, but there's a lot of foods in that list which may be very nutritious but get very low weights because people don't necessarily buy a lot of them. And we use weights based on a nutrient profile scoring or a nutritional value scoring system. There are a lot of different systems out there. We've done a pilot with NuVal scores, which have been used in this photograph. They were developed to use in grocery stores in the United States to help inform consumers about which products on the shelf were more or less nutritious. So the products received a score of 1 to 100, with 100 being the most nutritious, meaning it has a lot of nutrients and fiber and sort of the components of food which promote and protect health, and then it doesn't have a lot of the more negative components like added sugars and salts and saturated fats or trans fats. So it's a scoring system based on those two ideas of healthy components and unhealthy components of food. And it's just the one that we've used, NuVal, is, as a prototype, is one of many that we could choose. We'll actually probably be revising it because since we started the project, the database of NuVal scores, which used to be publicly available, became unavailable for various reasons. So we will probably switch the scoring system to one that continues to be publicly available, but it's a similar concept, whichever scoring system is used. And here you can see what happens to the food basket when you switch the weights. So this is a food, the weights from Ghana, and in the CPI basket, compared to the NPI, which is the Nutritious Food Price Index, you can see in the blue is pretty similar. People spend slightly more on cereals and cereal products than they are weighted for nutritional value. And then the orange, gray, and yellow is animal source foods, and that's also pretty similar. The big difference between these baskets is the weighting of fruits and vegetables. So the green and the light blue get a much bigger weight when we use nutritional value compared to expenditure share. And then also the oils, sugars, and soft drinks and juice, people spend more on them, obviously, than their nutritional value, which is very, very low. So the big differences are the nutritious food price index upweights fruits and vegetables, and downweights sugars, oils, and soft drinks compared to people's actual expenditures. So when we look at a comparison of these two indexes, the orange line here is the typical measure, which is tracked by the government, which is the CPI, and this is just the food portion of the CPI. And then the NPI, we can see we've separated it here by two very different regions. So here in Accra on the top, and then Tamale, which is in the north of the country, on the bottom. So we can see that in Accra, the prices of more nutritious foods actually rose less than the prices of other foods, typical basket. But in Tamale, it was the opposite. So the prices of the nutritious basket rose more quickly. And that's the area which tends to have more food insecurity and nutritional problems. And this visualization, it's hard to see a big difference, but when we actually compare, if we just zero out the normal and compare the nutritious food price index to the regular CPI, if we make the difference between the two, we can see there are actually significant differences. So here, there's some implications potentially for policy or programs. So we might say that in Accra, nutritious diets are actually affordable compared to the norm. And so maybe what's needed is behavior change. Whereas in Tamale, we really need to put attention into better availability and affordability of more nutritious foods because their costs are rising more quickly and they're becoming less accessible to people. So these indexes are unit-free, so they don't tell you how much you have to spend every day to buy a nutritious diet. They tell you how prices change over time, so you can compare and track changes. So to measure the cost of what you have to spend every day, we need to use other metrics, and one of them is the cost of a recommended diet. And to be able to measure the cost of a recommended diet, we have to understand what types of foods and in what quantities people need to eat them every day. So for this metric, we used food-based dietary guidelines, which are designed by countries to provide both nutrient adequacy and protection of health against NCDs. So they're really fit for this purpose of protecting from both, the whole range of malnutrition on both the undernutrition, overnutrition sides, and certainly in Ghana there is the dual burden. So it's a nice way to have a metric reflecting food that is culturally acceptable and promotes health. And it's an intuitive way to understand economic access to adequate food, like what would be a normal healthy plate of food. And it also can point out which food groups are the most expensive. And it's a metric that can be important for policy coherence, because if a country is saying, this is what we recommend for people to eat, but we don't understand what it costs people to eat in different regions of the country, it's very difficult then to go to a very poor region and say, you should be eating this, where people may just simply have the response of, that's great, how do I afford that? Or that's not available. So tracking the availability and prices is really important to put in place this policy of recommending what people should be eating. So in Ghana, unfortunately, not every country has food-based dietary guidelines, and Africa is the region which has the fewest countries of all in the world with guidelines. And there's only 6 countries right now, although we've heard that Ethiopia is developing new ones, which is I think several countries in Africa are developing guidelines, which is very helpful for understanding diets that are locally relevant and nutritious. So because Ghana doesn't have food-based dietary guidelines, at this point, we substituted the Benin guidelines because dietary patterns are somewhat similar, and Benin has made a very clear consumer guidance on how many servings. So here you can see for the different food groups, different ages, the number of servings recommended per day, and we've used the average amount for adults. And then they also have guidance on exactly what a serving means for different kinds of foods. So here they include cereals and starchy roots, different protein foods, including both animal source and legumes and beans, and then vegetables, fruits, and dairy. So when we look at the cost, here we use data from the Ministry of Food and Agriculture, and it's pilot data, so this isn't, don't quote this exact number because it's really a pilot number based on a small set of markets in the country. But what we found so far is that the cost per day of a recommended diet for Ghana, kind of an average, would be about above 3 cedis per day, which is about 75 cents. This doesn't include dairy because the Ministry of Food and Agriculture doesn't collect data on dairy. It's not consumed that much, and it's also, when it is consumed, it's more of a packaged product, and so that's, there's some data collected by the Statistical Service, but not the Ministry of Food and Ag. So here you can see that when you look at a per day basis, vegetables are more expensive than the other groups. To consume the amount of vegetables that's recommended, it costs more than the other groups. But then if you look at the cost per serving, fruits are more expensive per serving. There are just fewer servings of fruits recommended than vegetables, which is why there's this difference. So you can look at the data in different ways to see which kinds of foods are most expensive for people's budgets. And the Ghana Health Service is actively pushing fruits. Apparently there's a need for greater fruit consumption. This is the front of the Ghana Health Service building, and maybe one of the reasons is fruits are relatively expensive. So another thing that we can do with this data is use it to map differences by region. So this is a map that's come out of the collaboration with the World Bank, and we have used data from Pakistan to look at the cost in different regions and to see that, so what we haven't done yet, which is the next step, is to compare it to income in different regions. So we have a better measure of affordability. This is so far measures of price, and you can see the price is variable across different regions. And when you look at the commodities, which are the food groups which are most variable, dairy, fruits, and vegetables are more highly variable between different places in the country. And that probably has to do with perishability issues and making it more difficult to transport and store these kinds of foods as compared to starchy staples, protein foods, in particular legumes, which are pretty easy to transport and store, and then oils, there's almost no variation. So we haven't done this yet for Ghana, but maybe that's the next step. So then the other metric that we've been doing a lot of work on is this cost of nutrient adequacy. And here I'll turn over to Will to go through our initial results on this metric. But it's a standard that, it doesn't necessarily come up with a diet, unlike the cost of recommended diets, it doesn't necessarily come up with something that looks like a normal, palatable plate of food. But what it does do is make easy comparisons across all countries, because one issue with dietary recommendations is that they're not all the same in every country, and there's no global set of dietary recommendations, so it's sort of a country by country metric, whereas this one you can compare across countries and find kind of the most expensive nutrients and the foods which are the kind of best bang for the buck in terms of being very nutritious but low cost. So we'll let Will explain more about this metric.
So what we found using the Ghana data that Anna described is this remarkable feature of the Ghana data, and we'll talk about the difference between Ghana data and Ghana reality in a moment, which is that on the basis of the foods that MOFA is tracking, that the Ministry of Food and Agriculture is tracking, the most scarce nutrient, the one that's hardest to meet through foods, is vitamin A. And to the extent that the foods tracked by MOFA would be representing this lowest bound for the poorest Ghanaians, it would indicate that the system really, the food system, is really limiting in its accessibility of vitamin A much more than items that are not limiting at all, which are here zinc, iron, and so forth. Those are coming along for free because there's enough of them in the soybeans, the cereal grains, the other foods. We haven't here taken account of anti-nutrients that might be in food. Those are things we're continuing to work on to make this a richer, more realistic depiction. But from this first pass at the data, we get already a pretty clear signal about a food system that is failing to deliver a specific nutrient at an affordable cost. And of course, that's because of the high cost in terms of foods of this food group that has been identified based on vitamin A content as the vitamin A-rich fruits and vegetables. This relates, of course, to the recommended diet results that Anna just described. So we're seeing concordance between the different methods and in terms of the message regarding Ghana. The comparable work in Tanzania shows how a different food system and a different set of foods in the database give us a very different message. Here what you're seeing is a wider range of micronutrients, both minerals, like calcium, and folate, and the vitamins, but also showing that energy requirements are a constraint on meeting daily nutrient needs in Tanzania. I hope I don't need to tell you that Tanzania is a much poorer country than Ghana. So it's a country where the relative cost of food is still constraining in terms of just daily energy requirements. The micronutrients come along for free, in a sense, in this context, to the degree that daily energy needs are met, but there is still vitamin A as a constraining nutrient whose cost is important, and also vitamin C, and here, crucially, B12 relating to animal source foods that in this context is coming from dried fish. So the food groups that you see are at the top, the dried fish contribution from and then what you see is how our cost of nutrient adequacy method captures the opportunity for people who might need to meet nutrient needs at the lowest possible cost to be flexible about which foods they use. So what you see is that the foods used to meet the same nutrient needs switch back and forth from, in the lower case, the amount of starchy staples you would want on the plate versus the amount of pulses, the ground nuts in this case that you'd want on the plate. Those oscillate. And then sometimes dark green leafy vegetables are a low-cost source of nutrients, and sometimes they're not. So when we're looking just at this lower bound of what is the absolute cheapest way to meet nutrient needs, we see that this method is accurately capturing the fact that sometimes you would want one food and sometimes another, and that sustaining the same diet over time is a luxury that costs more than the bare minimum. Of course, people do seek that luxury, but it is something above the bare minimum cost, which is what we're tracking here in order to get our universal metric. So we're able to compare not just across time, but also across different food systems. So you saw the contrast between Ghana and Tanzania in terms of which nutrients were limiting. You can also see the contrast in terms of affordability here in international dollars, so purchasing power parity, comparing the two. You see roughly the same cost level of food in international terms. But of course, Ghana is a richer country than Tanzania, so the affordable diet is more, the minimum cost diet is more affordable to a typical worker in Ghana than in Tanzania because of the Tanzanians' much lower incomes. You also see that the Tanzania price level is more stable than the Ghana price level. And that relates to this point about data. As Anna mentioned, the Ghanaian system had not tracked dairy, but also not tracked green leafy vegetables, and also not tracked certain other foods that might enter a least cost diet if we had data to include them. And as we'll talk about when we turn to the Ghana story of the policy engagement that Anna mentioned, Professor Sarpong will talk about how that worked out in the Ghanaian system. There'll be potentially leading to new data that would lead the Ghanaian numbers to be more stable because it would have the more diverse foods that the Tanzanian data collection also has. The Tanzania data collection system also differs from the Ghanaian one in terms of which markets they go to and which products they sample. So when we go to the in-depth discussion about the application of these methods, we'll see that the results we get depend on the data that are collected and the need to be very sensitive to, in the first instance, helping agencies collect more nutritionally appropriate data. And then when we go to analyze those data, to make sure we're aware of what was collected, so we're able to see when the thing we're looking at is a result of the way the data were collected, as well as the results. But from the basic method, we get some pretty striking messages that when they have this concordance between the different methods, we're pretty confident this is a really true and valid and important finding, and we'll be able to make many more, I hope, discoveries using this method. Some applications that we'll talk about have been to look at seasonality, the role of market infrastructure, the role of local agriculture and productivity of nutrient-dense foods in lowering their cost in certain places. And I'm sure we'll be able to think of many other kinds of applications for these methods. So here's the story on seasonality, where our first application of this in terms of a research question was to ask whether the nutrient-dense foods are more seasonally variable because they're more moisture intensive and less storable, more perishable. And what we found in Tanzania was that there was actually no statistically significant seasonality in the cost of calorie adequacy as such from the starchy staples. The dashed orange line is the cost of calorie adequacy that someone mentioned having studied using the PROPAN data, I believe, the PROPAN method. And that's the cost of calorie adequacy that you see here in the orange. That's not statistically significantly different from a horizontal line. There appears to be some seasonality in it, but there is clear seasonality in the cost of meeting nutrient needs because those nutrient-dense foods have much greater seasonality. So using this method, we were able to pick up a signal that we were pretty confident would be there, and then applying this method in Tanzania will help us to show which markets have less of this seasonality and what helps that seasonality to be dampened. One of the concerns here is that we're providing this proliferation of methods, and we now need to winnow down, to select which methods are the ones that will be most useful, most fit for purpose for the different kinds of research or policy and program analysis that you would have done. So these correspond to different definitions of nutritious diets. What is a nutritious diet? So we have the unit-free indexes that track change over time. This NPI that Anna described with that upweights the more nutritious foods and downweights the less nutritious one. The cost of the full basket as specified by a dietary recommendation, and the cost of nutrient adequacy as discussed just now. So we expect to see quite a lot of innovation, better and better definitions of nutritious. So in particular, I mentioned that we haven't yet been able to take account of phytates and other anti-nutrients that would limit the absorption of this zinc or iron that we that so far we've said is available, but perhaps isn't, and so we need to count phytates as an anti-nutrient. We also need to count the different nutrient needs of different subpopulations. So the results so far are for an average woman. You saw from the modeling diets learning lab yesterday that the cost of nutrients to meet the needs of an adolescent girl would be higher because it need a much more nutrient-dense diet. And so we'll need to refine more precisely cost affordability of nutritious diets for whom. We're also interested, very keenly interested, in the difference in cost that you get when foods are or are not available. So as you know, some markets, there will be a stock out, complete not availability of certain foods, and we need to make sure we're tracking that better. So a big frontier of improved measurement. And I hope that this agenda extends way beyond the specific projects that have the data and the results that we're able to share with you kind of from these slides, right, to the discussion you'll bring from the data that you would have and the calculations you'd be able to make using the methods that we'll do in our hands-on exercise now. The workshops so far have been very, very different in tone, what we've done in Accra here and what we did in Dar es Salaam in terms of the agendas that people bring. They're really different agendas depending on their circumstances. So this is a rich area of research in terms of stakeholder concerns that sometimes focus primarily on finding methods that are easily understandable to broad policymakers, and sometimes focus on very narrow technical questions that are really of interest to nutritionists. We want to make sure we provide methods that respond to different interests. This is something that there's a big audience for internationally. So if any of you are really interested in picking up these methods and writing papers with this, I think you'll find a pretty strong demand for it in terms of project opportunities, presentations, and so forth. So I'm glad you're here. We can get a start on doing this kind of work yourselves, independently, or together. We believe, we're optimistic, that this kind of research can have real impact, because if we are able to show that a project or an infrastructure investment, a market development, a trade policy reform really does make nutritious diets more affordable, that people will notice that, will pay attention to it, and will bring the different parties together in a way that talking just in words maybe doesn't. Of course, you miss a lot of things when you look just at numbers, but still looking at numbers through these kind of metrics I hope is very helpful. We've had the impact that Daniel Sarpong will talk about within Ghana, and potentially lots of opportunities.
How do you make a choice of the foods for each country to come up with a price? That's my question. And the other is, for the nutrient price, did you also take into account the food fortification program? Because there are certain micronutrient intervention program like vitamin A supplementation, and also especially food fortification program. Actually, supplementation is just for the target population. So did you take account also that? Thank you.
The power of these methods is that they don't require anyone to collect additional data. You use data that's already available. So the choice of foods there, again, for the NSOs, the statistical organizations, their choice of foods in that list is based on household consumption and expenditure surveys, which doesn't necessarily always cover everything that is produced and maybe not sold. Not some nutritious foods can be missing, but we work with that data, which tends to be diverse. On the Ministry of Food and Ag, as we'll discuss more in the afternoon, here in Ghana, the list, when we started working with MOFA, didn't include any dark green leafy vegetables and was missing some key fruits and legumes and seeds. So we worked with them to add some of those really nutritious foods to their monitoring list, which is now institutionalized in the country. the choice of foods for our metrics, the nutrient adequacy uses all the foods in the list and just is a linear program to choose that the model chooses the foods which are the most nutrient rich at the least cost, which that's what the foods that were shown in the slides Will presented. And for the cost of recommended diet, you'll do some practice on that in a minute, but it's the choice of foods is the lowest cost 2 to 3 items within the food group. So that's one method. You could also argue, we've kind of debated about this, you could argue to choose the median cost as kind of a representation of a broader set of foods in each food group, but we've gone with the absolute minimum cost to meet those recommendations. So on the fortification, there was a really interesting analysis. We partnered with World Food Program in their Fill the Nutrient Gap analysis that they actually did in Ghana, and they did it first with the old MOFA data and no fortified foods. And then they redid the analysis with the new MOFA data, which had all these more nutritious foods in the food list. And they modeled what would happen to the cost if you also included fortified products. And the results were very different. So in the initial analysis, what they found was that you could not afford a diet that was adequate. It was just impossible. But that actually wasn't true, because the problem was that they weren't using data that had the most nutritious foods in it. So when MOFA added these nutritious foods and they redid the analysis, they found, oh, you can actually buy a nutritious diet because now we have visibility of the nutrient-rich foods, and the cost is lower than what we thought. And then additionally, if you add fortified foods to that analysis, the cost in some cases goes down. For some of the fortified foods, it did reduce the cost of nutritious diets, and in other cases, it didn't seem to have that much of an impact, depending on what the food was. Really, it depends on the data that's available and what you put into the model. And the issue is that because we're using monitoring data, they don't tend to have a separate item of a fortified product. So if maize flour has to be fortified as per national policy, then it would be automatically included in the price. But otherwise, there's no separate kind of price for a fortified or unfortified product.
I would like a better clarification in the event where you did not have data in terms of consumption for vegetable-related products from the ministry level. Was it because it wasn't documented at the national level? Or it is because the ordinary Ghanaian do not eat such food?
That's a fast answer. The Ministry of Food and Agriculture wasn't thinking about them. They have the mandate to measure food security, and there hadn't really been a revisiting of what that really means until we had this dialogue. And it's not that Ghanaians don't eat leafy green vegetables. They just weren't collecting prices of nkontomire or alefu, and I think they actually weren't even collecting okra prices. So it certainly wasn't a case of things that people don't eat. It just was that they weren't considered to be the most important commodities to track. But in fact, they have found that in addition to being nutritious, it's actually helpful to have information on those foods as well, even for economic interests in investing in them and growing them.
Where do you see these tools being used for large parts of the world where people self-source proportions of their diets? How might you see these sort of tools be used in terms of guiding policy in that respect?
Just first clarification is, suppose if we have a food group, so we are making the assumption of Hicksian separability, that prices of food items in a particular food group will not change over time and over space. So whether we use a cross-section or a time series data set. But there's a recent paper in JDE, Journal of Development Economics, which contests in all of Deaton's work that Hicksian separability does not hold in space and over time, and we cannot use any set of price index. That's what the paper says. So basically, we have to collect multiple prices for the same food items in a particular food group. And anything we do on food price, if it's being, so some papers are rejected on those grounds now. So, I mean, you are the veterans in this field. What would you say? We follow your work, Will. So I'm quite taken aback by this comment. I mean, because it's practically not possible to compute, even at a static point of time, multiple prices for the same food items belonging to a same food group. So, but it again contests Hicksian separability. So how do we go about responding to a reviewer on this? Thank you.
My first comment is whether you thought about some sort of adjustment factor to account for own produce, because most of, or not most, but a large portion, let's say, of the poor in Sub-Saharan Africa live in rural areas, and a big percentage of what they eat, they produce themselves, so probably these prices are not representative of the cost to them. So whether you thought about some adjustment factor, because it's not the same, the opportunity cost to them. And the second one, in terms of the graphs on the cost of nutrient adequacy, I thought that tells us maybe half of the picture in terms of affordability, because we also have to look at the income and the purchasing power of the income. So whether you also look at the evolution of the purchasing power of these populations in terms of what percentage of the population can afford a nutritious diet. Because probably some of these agencies that collect this price data also collect data on income, although there's a lot of issues collecting data on income, but probably you can also look at the purchasing power over time.
I'm very interested in the cost of the diet and adequate diet for the urban populations. As I understood, you're taking your data from supermarket prices. And a lot of the urban population actually goes to a market, not so much a supermarket. Do you have any idea of how large open market prices relate to supermarket prices? I expect there's a big difference, that supermarket prices are much higher, and that are actually not the prices that a lot of the urban populations are paying for their food.
Indeed, do you include also more informal channels? And the second one, what about origin of the foods? Because what we did, we collected the price data because of food safety considerations. So for example, if we compare prices of certain food products between different types of outlets, for example, the supermarket or a normal street market, the price difference is often also related to certification schemes. So instead of only looking at nutrition, we made a combination together with food safety guarantees. And I was wondering if your model would allow also to include kind of origin variables to also balance out these two different aspects of healthy food.
Thanks.
Recall that we are using data that is collected by the Ministry of Food and Agriculture. And the prices they collect is not from supermarkets. They are from typical local markets. When you enter a market, really you will see different varieties for the same commodity. Now the question is, which price are you taking? So just like the Statistical Service will define who a typical consumer is, we also define a typical housewife who enters the market and will be buying a certain product. Take tomatoes, for instance. You enter a market, you see an upmarket where tomatoes are packaged and it's wrapped in polythene bags for sale. You also enter the same market and you see tomatoes that are on the floor in heaps for sale. And then you see tomatoes that are on tables for sale. So the question is, which one would a typical housewife buy? So that is how the Ministry of Food and Agriculture defines how they pick their prices. So it is basically the middle one, which is what we would attribute to safe and nutritious food. Not the ones that are on the ground and not the ones that are outside the reach of the typical housewife. So the data is taken from traditional local markets, not from supermarkets.
And I can follow up on a couple of other economic angles. One was the question about affordability and relating to wages. And for that, there's a huge agenda about whose wages and which particular type of household would you be wanting to compare to. This relates to the other question about accounting for self-provisioning. Just to give you a flavor of what's possible to do, our work in Ethiopia is capturing affordability by people who are doing unskilled landless workers, of whom there are, as you probably know, a lot in Ethiopia. So that specific category of affordability we can track using the unskilled wage data that are collected at the same market locations, approximately the same location as the point of sale. Otherwise, you would have a mismatch between the income data and the expenditure data. Regarding self-provisioning, of course, that's a huge issue. And we really here are focusing, not on that, but rather on the ability of the food system to deliver for a market participant, recognizing that in fact in many rural areas there are many either completely landless or very land poor households that are buying very much of their food. And certainly for the seasonality issue, we're capturing those who are needing to turn to the market for one reason or another. We are interested in applications that would extend even further, but that's yet another frontier of great research to be done in this domain. For anyone who's interested in publishing in economics journals, this is a pretty hot area. These are debates that are very active, not just in the nutrition world, but also in general economics.
I just want to say a couple of additional points on the own production side. As Will said, these metrics are capturing what's available in the market. And of course, there is own production that is a major source of food for people, especially in rural areas. And I would say that what we haven't discussed here is what you do with this information. I mean, we've been focusing on metrics that provide information. And then there's a whole other conversation about then what? So fruits and vegetables are expensive, right? So then what? There are a lot of things that a government or a program could do about that. And one of those things could be to say, fruits and vegetables are really expensive in the market. Let's make them easier to produce so people have them in their gardens or in their farms. So that's one use of the market data. And then there was a question about origin of food and different aspects of the food collected, where the prices are collected. And I just want to emphasize that because we're using the methods and the data collected by the government, we use what they collect. So the information is just the price per food. It's not asking where the food came from or what the quality of the food is. They have methods to select, as Professor Sarpong said, of which quality is the level at which they collect prices. But the price is the data that we have. Now, if there were other projects or research programs where you were going out and collecting your own data, of course you can add these other variables and look at differences in price of a high quality or a low quality product or a different sourced product. So I think there are ways you could tailor your own research on food prices to address those questions, but for the purpose of national monitoring, we use the data that's available. If you start by looking at the data sheets, one of them is for Tamale, and then one of them is from Accra. This is actual Ministry of Food and Agriculture data that was collected in these two locations. It's just a subset of foods. And you'll notice that in each data sheet, for each food, there are 2 time points, one in November and one in December. So first what you're going to do is choose either Accra or Tamale. The next step is to go through this set of foods and think about which food-based dietary guideline category each food belongs in. So for example, the first item on the list is alefu amaranthus. So that would go in the vegetables category. Once you have them categorized, you look through this list, and for each of those categories, follow the worksheet, which gives you instructions for choosing the cheapest foods.
What will qualify as a fruit in the list that we have? Okay. So that's the first thing we have to do, grouping them into starchy staples, protein foods, vegetables, fruits, dairy.
I would classify carrots as vegetables, but as time went on and I've seen literature that has classified carrots as fruit and tomato as a fruit. So classifying was confusing.
Botanically, tomato is a fruit, but culinarily it's a vegetable, and it's in the guidelines as a vegetable. So yeah, there are classification questions for sure.
I realized that potato is starchy, but here you have orange sweet potato, which is nutritious, and it has very good protein content. So we are confused either to repeat orange sweet potato as starchy and at the same time as protein.
That's another example of classification. So sweet potatoes of all kinds are starchy staples. And there's all various kinds of, starchy staples can have wide variation in nutrient content, whether they're whole grains or refined grains. Teff in Ethiopia is super rich in iron as compared to other grains, and orange sweet potato has more vitamin A than a white flesh sweet potato, but they are starchy staples. And one of the ways we can use this is to try to find, especially in the other indicator, but the very nutrient-rich versions of each food category. So were there any other specific foods that presented issues like this, the sweet potato or tomato being examples?
Why don't they put them in the food groups for the user, so that it's just, if I'm looking for vegetables, I know this food has already been classified, rather than to solve the misclassification problem? Because if you don't have knowledge about the food groups of the various foods, you may misclassify some of the foods.
The Ministry of Food and Agriculture definitely does not group their foods into food-based dietary guideline food groups. They're not nutritionists. There may be one or two in the whole ministry who might be nutritionists. So they don't group their foods that way. So it's probably something very useful that in working with ministries of agriculture or non-nutritionist groups, that we would provide a reference document to say, these foods are in this group and these other foods are in another group, to make it easier for people to implement the method. But this exercise was to show that it's really a method that can be implemented by any project. So I think reference documents for where foods belong exist and can be made available, but it's something that will not come along with the data set, most likely. And so we'll have to that's why we put it as part of the exercise, to show that, it's part of the process to categorize things and decide which food group they go in to find the lowest cost item. The guidelines themselves recommend variety, and especially in fruits and vegetables, they say a variety of fruits and vegetables. So it wouldn't be following the guidelines to just have one fruit or one vegetable as the representation. But dairy, so did anybody find dairy? Good, okay, so that's to illustrate that sometimes data sets don't have all the foods that you're looking for. And so in Ghana, we've had some discussions about this because dairy is not a big part of the diet. So, we were using the Benin dietary guidelines. I don't think it's a really big part of the diet in Benin either. But it's a point where we felt like even if the Ministry of Food and Ag does not collect data on dairy, we still can come up with a cost that mostly meets recommendations and is culturally appropriate and consistent with dietary habits. We did have an issue, though, when we started that it wasn't just dairy that was missing. It was also green leafy vegetables that were missing and some of the major seeds and nuts and legumes that were missing. So when you have multiple food groups that there's just no food example, it's very hard to calculate this metric. So for vegetables, dark green leafy vegetables has to be one of them, as you saw in the instructions, because that's explicitly noted in the guidelines, to have a variety of vegetables, including dark green leafy vegetables.
When we were doing the calculation, I looked at groundnut, which was the lowest we used for protein. And I realized that for preference sake and for also nutritional requirement, somebody might decide not to use groundnut.
When you have a starch and plant source, like a legume, groundnut or soybean, it's a complete protein. But it's a good question of, so for these food-based dietary guidelines, they put all protein foods in one category. There's no separate requirement for animal source foods in particular. But what would happen to the price if we use dietary recommendations which require an animal source food? Yeah, the price would go up per day, for sure, because groundnuts and soybeans were definitely the lowest cost by far of the protein foods. So if for preferences or for bioavailability, other nutritional reasons people included in animal source foods, your price will increase.
Well, that was quite interesting because we're told that protein is generally the most expensive, and yet when you work it out in terms of the amount you're meant to eat, just gives a notion to all those protein drinks being a waste of money, really, doesn't it?
I'm looking at, groundnuts and soybeans. Those are the two, the cheapest sources of protein. But the amounts that you need to consume to meet the serving sizes, is that consistent with the amounts that people actually consume in the regular meals or the regular dishes? Because I know that in some places they just use maybe soybean as a snack, and eat very little, or groundnut as a dip, and things like that. So in that case, then when you have these foods coming up as the cheapest source of protein, will people actually eat the amounts, like this serving size? Is it feasible in terms of what people would regularly eat? I don't know. I mean,
it is by definition, because we're using the food-based dietary guidelines and the serving sizes specified. And the purpose of creating food-based dietary guidelines is to create something that is realistic and culturally appropriate that people do consume. Your question is very appropriate for the cost of nutrient adequacy, where sometimes there are large amounts of nutrient-rich foods which would come into the model, which might not be something that people would normally consume. But here it is, and I want to note that one step that we did for you is to give you the price per serving, because the Ministry of Food and Ag does not give us price per serving. It's something that's a data transformation that's not very difficult to do, but it's an important step to be able to do this analysis.
How do you calculate the price per serving?
So if it's 100 grams in a serving for vegetables, then you just take the price per kg and divide it by 10, and then you have the price per serving. So there's one more small step in there which has to do with making sure you're only counting the edible portion. Really important things like melons, where there's a big portion that's not edible, which is part of the cost per kg. So you have to subtract out the inedible and then do the step of transforming to edible cost per serving of edible portion. So those are the three steps to change cost per kg into cost per serving. I wanted to ask one more question about the different regions. So between Accra and Tamale, what were the differences that you found?
I was just saying to Isaac that Accra has a lot, I mean, there's a sea here and there's no sea in Tamale, but then even the fish here is more expensive than the fish in Tamale, and I was wondering why.
And so I think one of the comments earlier was that a useful step would be to compare the price to incomes in the area. So in Accra, the prices are higher, but incomes are higher as well. Of course, it depends on which population you're talking about. If there's, urban poor who have a very low income, then they're going to be faced with high prices in Accra. The U.S. actually somebody did an analysis of the cost of meeting the U.S. dietary guidelines, and they incorporated a measure of convenience because of the cost of getting to a place to purchase the food, and that'd be somewhat similar to your suggestion of cooking fuels. Very important in what it costs to eat. The point of this here was just to show you really how it works and the steps involved. Of course, it would be easier to do this with a computer, but you can see that it is actually simple enough that you can do it by hand, and with especially some guidance on the cost per serving and the food groupings. It doesn't take a lot of expertise to be able to come up with this metric that is very useful for nutrition, and it doesn't really require an extra budget line to do this on top of what's already calculated.
Cooking fuel is subsidized by the government in most of the developing countries, so that neutralizes the effect. So, at least in India, we subsidize the cooking fuel and starchy products, cereals, so then it doesn't affect the computation.
And also one of the questions here is, you might use the lowest price or the medium price, so what is the real practice?
Well, the purpose here is to understand for policy coherence, what it really would cost someone to meet dietary recommendations. So there has to be some variety within food groups, which is why we have more than one food per group. But we've had debates and uncertainty about whether it really should be the very lowest costs or whether it should be something more like the median, which maybe is kind of a representation of the variety of what people might choose. So if we use the median, what would happen to the metric? Clearly it would be a bit higher. So what you've calculated is the absolute rock bottom, lowest possible way of meeting the guidelines. But there is an argument that maybe that's not quite correct for the reality of what people face.
Here in the exercise, you have around 2 foods per food group. So in practice, how many foods do you select for this kind of real work?
People may select 5 different foods in a group. It just depends on preferences. This is, again, just a method for the lowest possible cost. And so you could do this with servings appropriate for children if you wanted to come up with a cost for a child. So one suggestion we actually had from the government stakeholders was it might be useful to do this as a cost of diet per household, which could be a next step of an average household composition. How much does it cost for children, adult male, adult female, and come up with a cost per household. Okay. Yeah.
Now you could see that we have missing prices in some of the food groups. So how did we try to engage the Ministry of Food and Agriculture that is involved in collecting data? And then how did we get buy-in from the other stakeholders? So that is the kind of story I want to tell you. When we started this project, what we did was to engage all the stakeholders involved in agriculture, food prices, monitoring of agricultural issues and food prices. So we got in touch with Ghana Statistical Service, we got in touch with Ministry of Food and Agriculture, we got in touch with ISOCO, we got in touch with all those who matter, and then we had a kind of a conversation. Now, right from the beginning, Ghana Statistical Service were very willing to compute a nutritious food CPI, provided we tell them what they should collect. So right away, we could see a kind of a buy-in. So the next was then to talk to Ministry of Food and Agriculture around the same table. Now, Ghana Statistical Service collects a standard list of about 82 foods. So this was tell us what kind of foods we should collect, and then we'll do that. And then tell us, we'll compute that for you. So we had that buy-in from Ghana Statistical Service. Then Ministry of Food and Agriculture, they were very, very interested, especially the unit that collects data, food data, the MOFA SRID. They also have a very robust monitoring system in all their districts. So they have markets in all the 10 regions and all the districts that are in Ghana that collects food prices from market places regularly. So regularly means that market days, they go there, they collect the data. So we had a very good buy-in from the head of the marketing unit, who is a very strong champion of the data collection. So we had the support of Ghana Statistical Service, we had the support of the MOFA SRID. Now, MOFA aims to help ensure economic viability for farming in Ghana, and also food and nutrition security for Ghana. So that's their mandate. Theirs is to meet government's objective of ensuring that there's economic viability for farming communities. And so the ability to say that production is going on, production is going up, so we are meeting nutrition and we are meeting food security. That was their mandate. So MOFA supported this mandate, so they provide information for decision making in agriculture, and most of the things that they track is production data. So they track production data. So they collect prices on a weekly basis in 164 markets nationwide. And this provides a powerful structure to track access. So it provides a powerful structure for us to be able to track access to nutritious foods. Now, looking at the data they had, there was some missing information. And that is to know if what we are doing is positive for nutrition. In other words, our conversation with them and the kind of data that they collect, is this something that could help in providing an out way for looking at nutrition positively, and then also to be able to support decision making about what we, the project, can do to better improve nutrition. So in the conversation, what we saw was that the food list for food price data collection was missing for some nutritious foods. And the information that was there could be used for many basic commodities, but could not very well track the cost of nutritious diets. Remember we said MOFA was collecting production data. So for them, it was mostly some commodities, and for some, it was basically out. So when you have that kind of information, and from a nutritious food perspective, it becomes difficult to formulate informed policies and programs towards food and nutrition security without data showing the problem areas. What we did with stakeholders was to first look at the list of foods collected by Ghana Statistical Service, and then also look at the list of foods collected by the Ministry of Food and Agriculture. Now, if we had a dietary survey, if it was available, then of course we could have taken this data from there, but we didn't have that. So we had to look at data that was already available. So we looked at the GSS data, then we looked at the Ministry of Food and Agriculture's data, and then with that data, we talked to Ghana Health Service, we talked to MOFA WIAD is Women in Agricultural Development, and then we talked to nutritionists available at the University of Ghana to help us understand the list that is there and how we could, like what we've just done, classifying them into proteinous foods and starchy foods and all that. The aim was to include nutritious foods that are commonly consumed by the average household in Ghana. And this is very important. With this exercise, what you see in red is the outcome of the conversations we had with the Ministry, Ghana Ministry of Health, Ghana Health Service, the academics at the Nutrition Department, Public Health, University of Ghana, and then the Women in Agriculture and Development. So with that conversation, we're able to improve on the list of food groups that are collected by Ministry of Food and Agriculture. For instance, if you look at the cereals, already MOFA had their maize, millet, sorghum, rice. If you look at white roots and tubers, yam, cocoyam, cassava, all that were there. But look at the pulses. Look at the dark green leafy vegetables. So there was no contemporary in the price list. I hope you know what contemporary is. There was no alefu, amaranthus in their list. And then if you look at the seed and oil, there was no groundnut oil. If you come to the meat, poultry, and fish, no fresh fish, no chicken meat, no goat meat, no mutton, no snail. So what we did with that conversation was to urge them to include these in their price monitoring. That is the Ministry of Food and Agriculture's price monitoring. So now, what we have is that Ghana's weekly market price reports now include the foods that are marked in red. So in the expanded food list of MOFA, we have an additional 22 foods added in all, several dark green leafy vegetables, some fruits, 2 additional beans, seeds, meat, and fish in the form typically bought by consumers. Now, this list was piloted over 7 weeks between November 2016 and January 2017 in 4 geographically disparate regions. So Accra in the coast, then central region, then northern region, and then the Brungahafo region to test this pilot data. So now, MOFA's SRID piloted the expanded list and made a decision to institutionalize it nationwide. So now what is happening is that MOFA has expanded their list of data that they collect. They've sent this list to all the 10 regional offices, and they are pioneering this in 20 major selected markets. So the weekly market price reports generated for the expanded food list starts from July 2017, and they are based on the 20 major selected markets. Now, we said that one champion has been the director who is in charge of the data collection from the Ministry of Food and Agriculture, by name John Naughty. And John has presented this collaboration and the idea that this expanded list is important for meeting their own mandate. So he made presentations in several places, including this one was in Rome in December 2016, where they acknowledged the fact that the data they collect does not include all the diverse type of foods that one needs to be able to track nutritious diets. And the fact that it is important that in their food price monitoring, they include diverse foods that can be used to track nutritious, sensitive agricultural policies. So John talked to the audience in Rome. So he acknowledged the fact that they need that information for decision making. And then they also provided the fact that they can easily internalize the additional data into the routine work that they do. So in other words, they could add on those food lists without necessarily increasing how much it takes to collect the data. The only thing was that it was adding on a few pages to the questionnaires that they take to the market. Otherwise, the same personnel, and then a few tweaking of how to collect the data so that it reflects what is required for doing the kind of analysis that everyone would need. Then we met again after the piloting, we met stakeholders. We had to tell them the need, why it is important that we had to do this exercise. So from the stakeholders workshop, these are some of the suggestions that came up. That we need this to be able to enhance monitoring of and advocacy of improved food and nutrition security at the district level, at the regional level, at the national, and even for comparison at the international level. So all stakeholders agreed that it was important that we have this kind of conversation. And then it was also useful for intersectoral decision making, such as in agriculture, nutrition, and the linkages between the two. And then it was also important to inform important social programs in Ghana. For example, the school feeding program could use the indicators for provision of low-cost, nutritious meals. And then it was also agreed that it was important to expand the cost of recommended diets to households for comparison to household income. And then to be able to visualize using spatial mapping and links to nutritional outcomes, and that data collection and accessibility could be improved through tablet-based methods. MOFA, as you speak now, is trying to do most of these things. That came out of the workshop with the Ghanaian stakeholders. So, in a nutshell, what we have done is we've tried to let MOFA do the buy-in into why it is important for us to have an expanded list that can inure for policy making, looking at diverse food groups. Like we saw in what the exercise we did, that was from the data they had before we did the pilot. So it means that we are missing some of the important food groups, so that if we want to use the indicators and the metrics that we have developed, then we need to have a more comprehensive and a more diverse set of foods and then the prices. So that is the story I wanted to tell you in 10 minutes, so we can move on.
Just to make sure it's clear that there are many, many ways to use these measures. The one you did by hand with the food groups, that's something you don't need a computer to do. As long as you know the groups and the portion size, you can proceed to use that. The other tools might require more sophisticated kind of work, might be suitable for an academic doing a research project over a long period of time, and I'll show you some examples of other kinds of things. I also want to flag linkages to more research questions where, this A&H Academy is trying to deliver a set of methods and metrics and research results as well as tools to policymakers, program analysts, but also to other researchers, academics, people looking for kind of cutting edge type things that we could do. And the ARENA project, advancing research on nutrition and agriculture, is an example of that. So here what we're reflecting is ways in which to use our nutritional information about nutrient density of each food to think about the cost of individual nutrients. And my colleague Derek Heady at IFPRI has led this effort to take a much larger array of countries and look at how relative prices of nutrients, of the bundle of nutrients that's in each various food. So eggs, for example, which would be a source of not just proteins, but also a whole bundle of micronutrients and minerals relative to less nutrient-dense cereals. So this is asking the question, how costly is it to move out of staple cereals? And the cost per unit of weight is then converted to cost per calorie to see which type of food is most expensive. And that allows you to make these comparisons, advancing beyond the simple hand-done exercise that we just did here. So you could imagine lots of different food groups, and as Anna reflected, these food groups come to us from food-based dietary guidelines that choose whether a tomato is a fruit or a vegetable, decide whether an orange flesh sweet potato, is a starchy or a vegetable, starchy food or a vegetable. And the results are really quite striking. So this is from collecting data over all countries of the world, 175 different countries. On the left, you see the income groupings, high income, Latin American, Caribbean, North Africa, South Asia, South and Central Asia, and Western Central Africa, and then Eastern and Southern Africa, what you see is roots and tubers all have fairly comparable prices relative to cereals. Those are grouped naturally together in starchy staples. Leguminous grains about twice as expensive per calorie, so bringing in the added proteins and micronutrients in legumes. What you see is this sharp gradient in prices for fresh cow's milk, where fresh cow's milk is remarkably inexpensive in rich countries. So in the United States today, a least cost diet includes quite a lot of cow's milk because cow's milk is very, very inexpensive. In contrast, in poor countries, cow's milk is very expensive and so not in a typical least cost diet. In contrast, powdered milk, processed milk, is actually very inexpensive in poor countries, but still more than in rich countries. Then chicken eggs, meat, fish, and especially this category of complementary fortified infant cereals is especially expensive in the poorest countries. So this set of sort of broadening out the lens, looking at the whole cost of diet that we're trying to promote in this learning lab is giving us some insight into the opportunities to use nutrient data, use our knowledge as the NH part of ANH to inform food systems in a more careful, kind of thoughtful way. So the ARENA project, you can see the sort of costs and benefits of doing it that way. There are still many other examples of types of work you could imagine doing with this. I hope you found the sort of super simplified example that we just did to be useful in sort of beginning this project. And I do hope that out of this learning lab comes many different applications in terms of people have raised the issue of where to fortify, what needs to be supplemented, what issues arise with seasonality, what issues arise with home provisioning. There's so many areas of new work to be done. And I just feel really happy to be able to share this work with you today. So thank you so much for coming.
I wanted to find out if the project is still ongoing or it has come to an end. And then we know that about 22 food items have been added to the existing ones. How robust are the 20? How robust is the list now? Does it include like almost every food, or we still hope to see some updates on the foods?
And to just put that in context, we actually did not really intend to necessarily change the monitoring system. It just was that MOFA was really keen to work on this and expand their food list to be able to themselves track really important foods. But the GSS data was already, it's very difficult to change that because that's set by, they have a process in place which is comparable across countries, which comes from the national surveys of which items they choose to include, and it was already quite diverse. So, in a lot of places, the work that's happened in Ghana is exceptional because they actually took the extra step of adding to their data collection in MOFA, which wouldn't necessarily be required in some places and it wouldn't necessarily happen in some places. But again, this is a method that can be used with all kinds of food price data sets. I think the important takeaway, which MOFA acted on, was that if you don't have a diverse enough list with the food data you're working with, you can't come up with these metrics. So you have to have some basic level of diversity to calculate cost of nutritious diet.